Today we'll be talking about prioritizations from MD Help Tech. Today we are joined with Stefan. Stefan, thank you for joining with us today.
Thank you very much for having me today.
Awesome. Now we put up the slide. Awesome, Stefan. What is the exact workflow from order entry to authorization approval?
So, usually, what happens actually when the patient comes to see the doctor consults the patient, and if there is any procedure that the doctor sees that the patient needs to have, so the doctor prescribes that procedure to the patient, and then the procedure is like scheduled, and then the authorization part kicks in. So once the procedure is prescribed and scheduled, let's say if the patient needs to have an echocardiogram, so the echocardiogram appointment is scheduled in the future times, like 1 week ahead or 1.5 week ahead, whenever the doctor thinks that the patient should have an echocardiogram. So what we do, we actually go and check that when the patient is going to have the testing done, we submit the authorization in a timely manner and get the authorization approved in a timely way, so that when the patient comes in, the patient can get the procedure hassle free.
Awesome. Now, when do prioritization errors most frequently occur?
So, prior authorization errors usually occur when the correct diagnosis code is not mentioned to support that particular procedure code that needs to be done for the patient. Let's say if the patient is coming for an echocardiogram. Obviously, for echocardiogram, there are certain diagnoses that the patient should have to get the procedure done. If that procedure is sorry, if those diagnoses are not over there, so the insurance will not get the echocardiogram approved, and it will be going into a denial thing, and that denial might actually give like a more of a workflow towards the team.
What documentation elements are most commonly missing when doing these prior auths?
Proper details into the progress notes, correct diagnosis code that actually required to get the prior authorization approved, to support the CPT code, they are precisely missing. Let's say we submit out an authorization request to an insurance. We submit the clinicals towards the insurance that support that authorization request. At the day end, the insurance is asking about some kind of a test results that the patient must have recently had. If those documents are not with us, we are unable to submit those documentations towards the insurance, and that might get a denial rate for that authorization. If we try to gather those details, all right, like let's say if the clinic, what I mean to say is the clinic, if the clinic tries to gather those details, obviously it might take time for them to gather those details, and in that time period, the insurance might deny the authorization.
What role do CPT and ICD-10 codes accurately play in approvals?
That is a very good question. So, usually, what happens? Let me explain you in more detailed way. CPT acts as a roof, and ICD acts as the pillar to that roof. If you are submitting a procedure code towards the insurance for an authorization, and if you are not putting or submitting the correct diagnosis codes, the authorization will not get approved. It will be going into the denial. Once it will be going into the denial, then you will be going back and forth with the insurance for the peer to peer submission. Let's say the patient is scheduled for 2 days in, like for today's 18th, the patient is scheduled for 20th, and insurance denies the authorization. You were calling insurance to get the peer-to-peer done. The time frame of the peer-to-peer, let's say the peer-to-peer slot is available on Monday. The patient needs to get the procedure done on Friday. That might get delayed. So proper ICD coding to support the CPT code is really, really important.
What is the average turnaround time per specialty?
So average turnaround, it totally depends upon the authorization type that we are actually submitting. If it's an inpatient authorization, let's say for cardiology, the watchman and the TAVR, the two procedures are going into the inpatient side, and obviously that they are scheduled prior hand if the patient is going to have a TAVR or a watchman procedure done. Let's say if the patient comes to the clinic and the doctor diagnoses that the patient needs to get the like TAVR done in a very quick day. So we submit the authorization on an expedited way. Usually what happens, it takes almost like, yes, 4 to 5 days to get the authorization approved, because back and forth following and back and forth sending the required clinical, submitting the required documents to the insurance, it usually takes that much time.
Oh. Now, I know revenue plays a big impact with prior authorization as well. How much revenue is typically delayed due to auth backlogs?
You cannot even imagine the correct amount how much it is today, like it's thousands of dollars. Let's say if the patient is coming to have a myocardial perfusion imaging done. Now myocardial perfusion imaging is a very expensive test. It's a very expensive procedure for the patient to have. If delayed authorization, let's say if the authorization is delayed, let's say for example the patient is scheduled on Friday, all right, the 20th of February, and if you are submitting the authorization on today 18th or tomorrow the 19th, the insurance will not approve the authorization in 2 days because the expedited turnover time is 72 hours. 72 hours is the more like they require that the authorization needs to be approved in an expedited case. So if you're delaying the authorization and the doctor is going to have the procedure done, the doctor won't be paid because it is out of, like you could say, the time frame that is approved. If the authorization is delayed, the patient is really unhappy because obviously the patient has to pay from the pocket for that particular day.
And obviously, no doctor wants to do that.
Oh, definitely. The patient won't be able to afford these expensive tests, and the doctor does not want to lose the money.
Exactly. How do you prevent authorizations from being obtained too late?
All right, that's a good question. So here, let me actually tell you where the MD help desk actually jumps in. What we do, we usually try to work on the doctor's schedule in 1 week advance. So let's say with the facilities that we are working in or working with, today is the 18th. Our protocol is to submit the authorizations like 1 week ahead. So today is 18. Today we will be doing the prior authorizations for the procedures that are scheduled on the 26th or the 27th. So if we submit those authorization today, in maximum 4 to 5 days, we will be having a decision and approval on their authorization. So the patient will be coming on the 26th. His authorization or her authorization will be approved. The patient will be like super happy. The patient will be all like you could say convenient with the clinic, and the doctor will be happy that their authorization is not delayed and a good patient experience from the patient side.
Awesome. So basically, at the end of the day, we want to make sure that everyone is happy.
Oh, yes. If the patient is happy, the clinic is happy. And if the clinic is happy, we are happy.
Phenomenal. How do auth delays affect patient satisfaction and retention?
Let's say if you are a patient, all right, you are going to the doctor's office, you are being prescribed with a procedure, and you are told that on the 20th of Feb, you are going to have your echocardiogram done. On the 20th, you take the time from your busy schedule, you go to the doctor's office, and when you reach out there, you are told that sorry, we cannot have your procedure done today because the authorization was not approved yet. How will you feel?
Bad, annoyed.
Annoyed. Why? Because it's a complete day loss for you. You took your time off, you made some adjustments, you've made some adjustments to go to the doctor office, and at the end you are being told that you are you cannot have the procedure done. So obviously you will be annoyed. So that is the thing. Patient wants to switch their doctor towards another one. There are thousands of cardiologists out there. There are thousands of oncologists, radiologists. All right. So it totally depends upon the service that the patient is getting from the doctor. The good service they get, the happier the patient remains. And obviously, on the next year, when the doctors are credentialed with the insurance, the patient will definitely call the insurance and ask them, like, give me the same doctor, or they will like fight with the insurance to get the same doctor for them. This is something that we have personally experienced with the clinics that we are working with.
What compliance risks exist when services are rendered without authorization?
If the services are rendered without the authorization, the doctor is unpaid, the claims are unpaid, the doctor is losing the revenue, and like it's thousands of dollars that the doctors are losing revenue every day, you can say, because every day one or two claims are being denied because the authorizations are not there and the doctors are doing the procedure, and the doctor's office staff is not enough versatile, or you could say is not having the time enough to follow up on those authorizations. The patient comes in, the patient gets the procedure done, assuming the doctors or the staff assuming that, oh, we have submitted the authorization already, so it might be approved at the back end. So once the patient has done the procedure, when they go back and check the status of the authorization, it is denied. When they try to contact the insurance to go for a retro authorization, insurances say that we don't do retro authorization. So there, the doctor, the insurance has denied the authorization approval. The patient has not paid for the procedure. So it's a nightmare for the doctor. The doctor will not be paid for anything. The doctor did the procedure for free.
Exactly. Everybody wants to get paid when they're working.
Definitely.
How much staff time per week is typically spent on auth follow up?
So let's say if we talk about the doctor's office, they are pretty much busy with the patients physically there. They are doing the front desk side, they are physically interacting with the patient, so they don't have the time to go over the phone call with the insurances, stay on a long hold time and check what is the status of the authorization. So the follow-up usually takes a lot of time. This is where MD Health Tech jumps in and checks the authorizations are being followed up in a timely way. The authorization approvals are being like taken from the insurance in a timely way. If there is a delay in the approval, what is the cause of that delay? And we try to resolve that cause and get the approval as soon as possible so that the patient can come and get the procedure done on a very quickly basis.
How does staff rotations impact authorization consistency?
The doctors hire a staff in the clinic. So let's say the doctor hire an office staff and admin staff. He or she gets trained onto the doctor's protocols and everything. Tomorrow, a doctor is waking up from his bed and finds out that the staff has left. What will the doctor do? There is no helping him for the doctor in the clinic. The doctor will be obviously going into the delusions. So the MD Health Tech jumps in over here. We provide virtual assistants to the doctors so that the doctors cannot be diluted, they cannot be blackmailed by their in physical staff, and we provide them the best top notch service so that their revenue is streamlined and they don't lose any dollar on their revenue.
So we make sure the doctor never goes understaffed and always has a helping hand.
Bingo. Yes.
Phenomenal. Perfect. Thank you so much for everyone who joined. Thank you, Stefan, for also attending and talking with us. I hope you all have a wonderful day.
Thank you very much, Rohan. Pleasure with. Thank you. You take care.
You as well. Bye bye.
Bye bye.